Mr. Blunt.
Thank you, Mr. Chairman. Mr. Chairman, we can all agree that it's both desirable and necessary to make some changes in our health care system. We should build on the parts that work and fix the parts that are broken. Many people are satisfied with the coverage they have now, which is why the President and others consistently say, if you like what you have, you can keep it. But I have some grave concerns with this bill and look forward to discussing them with the committee. I, along with many of our colleagues on both sides of the aisle, have ideas that we believe would greatly improve our current system. We wish they were included in this bill. Most importantly, I don't believe that the government-run health care plan is the best plan for the people we represent. Our goal here should be to create a system that's more affordable, with access for everyone regardless of any pre-existing condition, and has more choices, not fewer choices. A government option would be like an elephant in a room full of mice. The fast mice get out of the room quickly. The slow mice eventually get crushed by the elephant, and the only thing left in the room is the elephant. As a Republican, I wish I could find a better analogy than that, but I think it describes what I believe would happen if we have this government competitor. This plan would simply lead us down a path to a single-payer system where there's only one choice. Americans would have to face the same issues that British and Canadian patients currently deal with, such as long waiting times to see doctors or receive routine procedures. If this panel thinks a plan that raises taxes, I believe kills jobs and limits access is good enough for the people that we represent, then it ought to be good enough for us. And Mr. Chairman, I plan to introduce an amendment to this legislation which would require all federal elected officials, including each of us and the President and the Vice President, to enroll in whatever government plan this body creates. I look forward to this debate and appreciate the opportunity for the discussion we're about to have, and thank you, Mr. Chairman.
Thank you, Mr. Blunt.